So we definitely wanted to tell you about what proactive steps we're taking, and wanted to give you a chance to ask questions, make sure we're addressing your needs. So I've done a lot of news briefings before, but I've never done one via Zoom. So you'll have to forgive me if there's some hiccups. And I'll introduce our speakers one by one to give them a chance to make some opening remarks, and then we'll take your questions. If anyone needs this later, I'm also recording on my end, so I can make a download link available later if you need that. But without further ado, I'll start with Julie Pride, the Champaign-Urbana Public Health Administrator.
Hi, good afternoon. Today we're reporting we have 91 cases of COVID in our county. 31 of those are active. 56 of them have recovered. 6 are currently hospitalized. And as you know, we've had, unfortunately, 4 deaths. We have also started reporting tests completed, and we're up to 1,714 tests. If you look at our graph on our website, you will see that our cases are continuing to be low, and we hope that continues. So I just want to ask the community to please continue social distancing. It works. These non-pharmaceutical interventions that everyone is being asked to do, as hard as they are super important, and they are working. So please continue.
Okay, thanks, Julie. Next, we'll go to Champaign County Sheriff Dustin Harmon.
Thanks, Pat. Good afternoon, everybody. So I'm Champaign County Sheriff Dustin Harmon, and I just wanted to reiterate what the Champaign County Emergency Operations Center is doing. We came together as a community many weeks ago to begin addressing this crisis in accordance with our longstanding plans to address infectious disease. So through our Emergency Operations Center, we call it an EOC for short, we were able to address the current public health emergency in a united fashion. This Emergency Operations Center brings together representatives from all of our county's different government agencies to coordinate a logistical response, share information, and make sure our county has everything it needs to combat, in this case, COVID-19. Just to give you a couple of examples of what we've successfully accomplished in the last couple of weeks. We've distributed over 11,000 pieces of personal protective equipment, or PPE, to emergency first responders in our county to protect our first responders and the people that they're helping. We've also secured and distributed over 150 gallons of hand sanitizer to our local hospitals to better protect our healthcare workers and our community members. One last thing, we've also coordinated with local hospitals to plan for a surge facility. We don't need that. Hopefully we will never need that surge facility during COVID-19. But we have planned for that, and so we're ready for it in case we need to take that route. Because we are taking a comprehensive approach to this, we are as prepared as we can be in Champaign County. I would be happy to address any questions on any of this after our next speakers have their remarks, and I'm glad everybody could join us today for this press conference.
All right, thank you, Sheriff Harmon. So next we'll go to Champaign Mayor Deb Finan.
Hello, everyone. I just wanted to take the opportunity to thank the community for continuing to patronize local businesses. There are many local businesses, particularly bars and restaurants and grocery stores, that continue to be open for curbside service or limited service. I think that it is important to stress that as we go out and we are in places like our local grocery stores, it is very important that we wear face coverings, whether you have a mask or not. I think our public health administrator would tell you you can use any piece of cloth. You can have a bandana or a scarf or an old t-shirt. Make sure that you are covering your face as you go out. But please do continue to patronize our local businesses. That has been very helpful. I also wanted to just take a moment to thank our incredible not-for-profit sector in this community and our local school districts who have stepped up with See You Better Together. for feeding families with school-age children. As the districts are getting food out to the children for lunches, they're also delivering groceries to those same families. There's a partnership with United Way and CU Community Foundation that has made this possible. They've already put $65,000 into that effort. They're hoping to raise $250,000. If you're one of the lucky people that continues to receive a paycheck during this time and you are able, please do consider making a contribution to our local charitable organizations. They're really doing good work and they're really important right now.
All right, thank you, Mayor Finan. And next we'll hear some opening remarks from Urbana Mayor Diane Marlin.
I'd like to thank the media for joining us today. And I was on a conference call a couple of hours ago with mayors from all over the country. And one of the speakers was from Johns Hopkins and some other researchers around the country. But one of the mayors said, we're standing between no longer and not yet. And we know that things are going to have to change and we're never going to be back to doing things, some of the things the way we did before. And we're not yet certain what the future is going to look like. But as you've heard, from the other speakers right now, we're making the best plans that we can to face that not yet that we know is coming. So anyway, I have spent a lot of time talking, encouraging the public and thanking the public for the social distancing and physical distancing that they've done. And I really, really want to focus now on the importance of face covering, as Mayor Finan has said. We have to take care of the people who are taking care of us. And that's, of course, the healthcare workers and our first responders, but it's also the people in the grocery stores, in the pharmacies, and in the post office, and really every business that we walk into today. We have to cover our faces just out of consideration for their health, and we have to assume that we may be infectious and that everyone else is infectious as well. So the more people covering our faces when we do leave our homes is going to be, I think, a way of life going forward. It's going to be a way of life for the next year to 2 years until we have widespread immunity and vaccine and treatment for this virus. So it's good to start practicing and getting used to the idea of covering our faces. And if you travel in different parts of the world, particularly if you travel in Asia, that has been a way of life for actually many years. So let's take care of the people who take care of us. And that includes everybody who is working in the service sector and in the businesses that we depend on to live these days.
All right, thank you, Mayor Marlin. So we're gonna go to questions now. I think the way we have to do this is I will go down my randomly assorted list of participants here and call on you one by one to see if you have any questions. If you don't have questions, that's obviously fine too. But I think we'll do it that way. That way we don't have everyone speaking at once. So when I call on you, if you could just let us know what agency you're with, and if you could direct your question to a specific person, I think that would be helpful as well. So I have Ben Zichterman. I can start with you.
Okay, I guess this would be for Julie Pride, but with the new testing data on the dashboard, does that include both public and private tests, or where is that coming from?
Yes, that's actually all tests that have been entered into something called INEDS, which is the testing database. So that includes everything, public and private.
Okay, and if Ben doesn't have any more questions, we'll go to Christine Herman next.
Yeah, that's good.
Yes, so can you hear me?
Yes.
Yep, we can hear you.
So my question for Sheriff Harmon, I just wanted to know when it comes to deputies interacting with people, what kinds of approaches are used? Is there a PPE or other clothes? And then any other efforts to prevent the spread of coronavirus at the county jail? I'd love to learn about.
Hi, Christine. Well, as far as the county jail goes, I did issue a press release yesterday. It was detailed. If you have not gotten a copy of that, I would be more than happy to provide one to you if you could send me an email. We are doing quite a few things in the county jail to make sure that COVID-19 stays out of the jail, including a 14-day quarantine for all new inmates, making sure that inmates have access to soap and water 24/7, making sure that all inmates and staff are screened for signs and symptoms of COVID-19 upon reporting to work or upon presenting to our facility. So those are just some of the things that the jail is doing that are highlighted in that press release I sent out yesterday. As far as on the road, so I communicate very frequently with the other chiefs of police here in the county. And we decided a couple of weeks ago that our officers will wear PPE whenever they have interaction with the public. So I can speak for sure for the city of Champaign and also the sheriff's office. When deputies or officers are out on a scene and there is any kind of chance that they will have interaction with anyone else, including other employees, they're using their masks. They're making sure they have their gloves on and things like that. We've also put into place proper hygiene as far as uniforms go. You know, some agencies can change at work when they're coming to work and leaving from work. My deputies are a little bit different, so we've presented guidance on, you know, changing your uniform in a room before you get inside your house so you're not spreading around anything that you might have gotten to your other family members and those types of things. And so really education, washing hands frequently, those types of things are really precautions that the law enforcement officers are taking.
Thanks. And one more question for Julie Pride. I emailed you about this, but I wanted to just have you discuss it here as well about have there been any confirmed cases at long-term care facilities or among health workers? Have you looked at the data at that level, or is that still to come?
That is still to come, except for I do know that, knock wood, there have not been any in the long-term care facilities. I have to say that they have been completely amazing. We reached out to them in early March with really stringent guidelines that were really more strict than what IDPH or CDC had. And we just talked to them about the importance of this, that this is based in science and that this is how the virus will get into the places. And they were absolutely amazing. And we reach out to them all the time, offering them additional personal protective equipment and making sure that they have everything that they need. But they really stepped up.
The other question for Sheriff Harmon, if I can ask, I know there was a press release sent out earlier about efforts to reduce new jail bookings. And I was curious to know if there were numbers or anything you can report on that in terms of trying to reduce the number of new people entering the jails.
Sure, absolutely. Again, in that press release, I think I've listed over the last month, we've had a 20% reduction in jail population. We've also gone from about 15 new intakes a day to about 4 new intakes a day. And this is really a collaboration. A lot of people don't realize, well, they may now because I've been preaching it like crazy, but a lot of people don't realize that I have very little say on who comes into my jail and who leaves my jail. A lot of that, if I'm told by a judge to hold somebody, I have to hold somebody. There's not a lot I can do about that. So a lot of the chiefs have been on board, and a lot of the officers have been writing what we call notice to appears. They're basically tickets saying you need to appear in court at a certain point, as opposed to making that physical arrest. That has really contributed to that lower intake and that lower jail population. At the end of the day, we want to make sure, it's a good balance between our techniques we use and a safe community. And so NTAs aren't ideal for violent offenses or those who might pose a risk to community. So those type of intakes are still coming in. However, say for an example, a shoplifter or a criminal trespass, criminal damage to property, those are being, more highly scrutinized as far as, can we write you a ticket to appear in court later, as opposed to automatically making that arrest at this point in time, which has been past practice.
Okay, thank you. I have Jacqueline Boatman next on my list.
Okay, sorry. We're having some technical difficulties, but could you hit on, I think this is more for Julie Pride, on if, like you see people wearing gloves in the supermarket and about cross-contamination and the importance of that?
Yeah, yes, gloves aren't really, they're not really necessary for exactly what you're talking about. This is something that if you get COVID on your hands by touching something that someone has coughed and sneezed on, what we need you to do is just not touch your face until you can really wash your hands really well. I do think that gloves tend to give people a sort of a false sense of security. We need gloves for, you know, bloodborne pathogens and things like that, but with the respiratory virus, for the most part, those are not necessary at all. You see people still using them in restaurants and things like that, but that's to prevent foodborne illnesses like they do all the time in a restaurant. But if you go to the store, there's really no need to wear gloves because, I mean, unless it doesn't hurt to wear them, but unless you think that it's going to, you know, somehow protect you, people still touch their face with gloves on. And of course you touch your phone, which you cross-contaminate. So there are better ways to do it. And one would be to not take your phone in with you and don't touch it until you've washed your hands. I never do that, even though I know better, but that is really a good thing to do. It's just hard to remember to do.
Okay, anything else, Jacqueline? Jacqueline, I think we're having a little, unless it's just me, I think we're having a little trouble hearing you. So if you have something else, we can come back around. I'm going to go to Joy Squire next.
That was my only question.
Hi, I'm Joy Squire. I'm with the Red Cross. I don't have any questions, but was invited to represent the organization.
Okay, thank you, Joy.
Thank you.
Paul Ciccini, I got you next.
Thank you. I'm not sure if this, I only have one question, but I'm not sure if it's better directed at Julie or the sheriff. I know some complaints have been lodged about PPE and blood centers. And I was just wondering how that was being addressed as far as PPE and the people who were obviously collecting the donations and, you know, what was being done for the people who were donating as well, so that basically, you know, everybody felt comfortable and that everybody was safe in that situation.
Sure. I actually am the one that addressed that, so I can address this question. So it was really one blood center that we really had the issue with, and I ended up talking to the medical director of there, which is from out of state. And some of the things that we seem to be running into are more like a corporate policy versus a local policy. And, you know, they have blood centers everywhere. And I just explained to him that, you know, in our community, this is how what we are recommending from public health to take care of people. And if they did not have masks for their staff, that we would be happy to provide masks for their staff. And so we did that. We made that offer. And certainly people who go in there also need to wear a mask to help protect the people who are working there. We also suggested something like a different type of thermometer where you don't have to take the mask down to stick the thermometer in someone's mouth. You can actually point it at the forehead and get a temperature that way. So it was, it got itself worked out. But yeah, sometimes there's just some discrepancies between what a place's corporate policy may be with what we would like to have done locally. But they are using the mask now, I understand.
Thank you.
Mm-hmm.
And Taylor Decker.
My question is for both the mayors. So neighboring cities are starting to create a plan for when businesses can reopen. What does this look like for the cities of Champaign and Urbana?
Well, we have an economic development team that has been meeting that includes both cities. as well as the Economic Development Corporation and the Chamber of Commerce and the SBDC. And so planning has begun in that respect. But I think it's important to note that we'll really be following the science and the advice of CUPHD. So we need to make sure that our businesses are prepared with PPE and social distancing and making sure that everybody understands the guidelines as we begin to slowly open. I'll turn it over to Mayor Marlin.
Thanks, Deb. In addition to being part of the economic recovery county-wide team, we also have an internal group that has begun to meet to think about ways that we do things differently and prepare for gradually transitioning back to whatever our not yet is. And it's going to be slow. It's not going to be like flipping a switch and opening a door and business as usual. That won't be the case. So it's going to take careful planning, and we've started that. But again, to echo what Mayor Finan said, we will follow the guidance of our local public health district, as well as our governor and recommendations of the CDC.
I think it's important. I've had a couple questions today about opening things up and allowing businesses to operate. And I think it's important for people to understand that we're operating under the governor's order at this point. Neither mayor really has the authority. We perhaps could do tighter regulations, but I don't know that we can do lesser regulation at this point. And so we really need to wait for the governor to act as well.
And what's one of the big things that will guide us is the fact that the reason our cases are low here in Champaign County and really downstate Illinois and has been due to the physical distancing and the governor's shutdown and no large gatherings, and that keeps spread of the disease down and keeps us from overwhelming the healthcare system. And we are going to have to use that as a guideline again throughout the next couple of years, I think, until we get a handle on this virus. And so any steps toward recovery and reopening the economy is absolutely tied to public health and the health and safety of the people. And those two go hand in hand.
Thank you.
All right, so that concludes my list. I think we'll end it there.
Patrick,
Thank you
can
all.
I ask just one more of Julie if we have a couple?
Sure, go ahead, Christine.
Yeah. You know, I've just been curious. I mean, it sounds like Champaign County, there hasn't been a need to open the surge facilities that you mentioned. But what about neighboring counties? If Champaign County is able to keep cases low, are there any efforts or initiatives to help neighboring counties if their healthcare systems begin to get overwhelmed?
Well, so you have to understand that Champaign County only, we have about 230,000 people that feed into our hospital systems, but the entire hospital systems have around 1 million people that go into them. So there are other counties are already use our facilities here. So, but there are all kinds of contingency plans in place for pandemic planning and hospital surges, everything from field hospitals to utilizing less used hospitals. So that yes, there are all kinds of different things in place. We hope that we don't have to do that. We like the mayor said, by the governor shutting things down early, that has really helped our state. Even though you're seeing still a lot of cases in Illinois, it could have been much worse. So this is kind of where we are now. And so far, the hospital systems, we're keeping it low enough that none of the hospital systems, knock wood, are being overrun at this time.
Yeah, it's important to remember, for example, Carle Hospital is a regional medical center and serves about a 25 county area with a 1.2 million population in that area. So it's a huge area. And we're not an island in this. We are connected to every you know, the entire region. And that's why it's so important to keep from overwhelming the healthcare system and our first responders and every other system we have in place.
Thank you so much.
Okay, thank you everyone for attending today. So our plan is to do this again next week on Thursday at the same time. If that time changes, we'll of course let you know. We will be rotating local experts in and out as well, depending on the issues of the week. So look out for that information. We'll keep you informed on that. If you have any feedback on this session today, you can email me directly. I think you all have my email. But thanks for attending, and I'm gonna end the meeting now. Thank you.
Thanks, Pat.
Thank you.